You're listening to Asia First Weekend Edition this Saturday morning. A very good morning to you. Justine Moss here with you. Now, are you flopping over your coffee table or perhaps sinking in the comfort of your bed right now? Pause, take a quick look at yourself. Maybe you're slouching or guilty of having a text neck. I know I do. Or curled up in a ball, perhaps. Working from home may be uncomfortable if you do suffer from chronic pain. And without, special sort of ergonomic office setups or access to a physical therapist, your body may begin to ache, your condition may worsen. Well, to share more now about why it's so important for us to take care of our posture as more of us work from home is Dr. Matt Khan. He's Senior Consultant and CEO of Chiropractic First. Good morning, Dr. Khan.
Hi, good morning. Hi.
Thank you so much for joining me this morning. Now, just give us, before we talk about working from home and the posture and the importance of looking after our spine health, just give us a little snapshot of your chiropractic journey, Dr. Khan, and also a little history of Chiropractic First.
Chiropractic first started in 1999-2000 with one clinic at somewhere near Orchard Road. Mm-hmm. And from there, we just grew organically. And in Singapore, we have 12 clinics. Here in Singapore, we have another 12 in Malaysia, and we have a few more in London, UK, in China, in Barcelona, so in Indonesia. So all in, we have about 30 over branches and about 40, 50 doctors with us.
Fantastic. I know that you studied in the US and you've been, you've had amazing experience in, of course, that area.
That's right. I studied in Palmer College, where chiropractic actually was founded and started. Yeah.
Fantastic. Dr. Khan, let's, talk about the importance now of adopting proper posture and also managing our spine health, because many of us are still working from home these days.
That's right. What we have found that we have a lot more new patient, and our old patient had a lot of relapses ever since working from home started. Being back at home, the posture has been taking a toll because people are sitting on the floor, sitting on the sofa, slouching over the bed, right, and doing their work. So even when they're seated on the dining table, the ratio of the height ratio of the chair and the table and the laptop is pretty bad.
Yeah. I'm going to put my hand up here and say I'm terrible. I will lie in bed with my laptop or, sit at probably a height that's not good with your laptop, right?
Yes, that's right.
Oh boy. Okay. So the importance then of adopting that proper posture and managing our spine health. When we're sitting sort of on the bed or on the couch with our laptops or with a writing pad or iPad or whatever, should we just consciously try and just straighten that back? I mean, it just sort of lasts just for a few minutes, though. It's quite difficult to maintain that posture, isn't it?
Yeah, especially with a laptop where you are looking down. We actually had to get all our patients to go to, some of the online platform to buy some laptop extender where they have to lift it up. By right, the screen should be all the way up to eye level or above, so that forces you to sit up straight. Anytime you are looking down, right, you start to slouch down, and the most you can do it with is just about an hour or odd. Then after that, your whole neck and the shoulder will start to take a toll. Yeah, especially the neck, because as you say, you're looking down, and it's just not natural to have that sort of, position for so long. Dr. Khan, talk about then the differences between going to a chiropractor like yourself and a physiotherapist. What can we expect when going to, say, visit a chiropractor? A chiropractor will look at the alignment and integrity of the spine, the vertebra, right? And a physiotherapy, usually there's active and passive, right? The active are the one that will work on, if you have injury where you sustain by damaging some of the soft tissue of your muscles, then the physiotherapist will do some passive means using some electrical modality to help it to heal, right? Or try to work on some of the symptoms like the swelling, right? And active physiotherapy is more for rehab, post-injury or post-stroke, right? So they're fantastic for that. Usually physiotherapy cannot diagnose. They usually follow instruction of the medical doctor or chiropractor. A chiropractor will be able to do a full examination and diagnose, right? Look at the X-ray. They're qualified to analyze the X-ray and do a full examination, structural and mobility and motion, right, of the joint integrity of the spine, and looking at the, how much is degenerated. Very often when patient comes to us, with sore neck and back pain, right, they would have already some old issues, right, and old injuries they have sustained, right, and because they are slouching down and they are sitting in the wrong posture too long, it just get aggravated. So they're aggravating an old problem or a weakened misaligned problem that has been there for a long time.
Gosh.
So a chiropractor will go down to the core of the problem and realign as well as remodel that part of the vertebra. Okay.
Yeah. Yeah, because you might not know it's getting worse as well. I mean, if it's an old injury, something perhaps that happened in, 10 or 15 years prior, then you wouldn't know that it was getting worse until obviously a little bit of pain, but until you went to a chiropractor. Yeah.
So that's right. So a patient with during the working from home, they have exceptionally sore neck or back, right? They would have these symptoms, right, on and off, regular enough on a weekly basis or a few times a week, right, when they sit about, longer than 1-2 hours or 3 hours, right, they have to move around, and some even 15 minutes, they have to stretch and twist their neck, right, all the time. So they already have that problem, and they have to really sit in a certain posture to avoid it being aggravated. But in a working from home situation, it just gets aggravated a lot more.
Yeah.
So that when they visit us, the problem has already been there, and when we look at the X-ray, it's like, wow, it's an old problem, So it takes a deeper approach to just managing the pain.
Oh, good. Well, some say it does look painful, going to a chiropractor where there's sort of, snapping and crackling and popping.
No, it's not. It's not at all.
Okay.
Right. Yeah, we do have some patients that are a bit squirmish about it, right? And then they were like, oh, but how can, how can a small kid, age about 5 or young school children, right, being adjusted, aren't they afraid? I said, no, look at them. They are happily jumping onto the table and getting adjusted, giving me high five. No, it's not painful. We are not twisting the spine, but actually, right, untwisting what is twisted, right?
Yeah.
And we are working within the range of motion of spine. So that patient actually do feel, absolute relief, right, when he gets adjusted, right? And sometimes you may hear popping sound, sometimes you may not. So it's not necessary all the time.
Oh, that's good to hear. That really is, and that you're working on young kids, and they, you're also helping. I guess it's chiropractor. Going to a chiropractor, any age is possible.
Yes, we see. We even see babies being brought in because of birth trauma, right? Some just parents just brought the baby in and say, okay, can you please make sure that the joint at the upper neck or the shoulder or the pelvic is working well, is not misaligned. So we do have kind of a inspection, right? And if there's an issue, right, it will be minor at this stage, right? And for young kids, we have patients with we have young kids with ear infection, right? Just working on the upper cervical part of the spine.
Oh, that's great. You're listening to Asia First Weekend Edition with me, Justine Moss. I'm speaking with Dr. Matt Khan. He's Senior Consultant and CEO of Chiropractic First. We're talking about why it's important to take care of our posture as more of us are working from home. Doctor, how many sessions would someone typically need, to correct bad posture or get rid of that bad back pain?
To correct bad posture will take a considerable amount of time, right? Number one, we need to look at two factors: the internal and external. The internal will be the integrity of the structure of the spine itself, whether it's an old issues that has been there for years and how long has been there, right? So when somebody say that, hey, I just had the pain started about last month, it doesn't mean that the problem just really started last month. If somebody going to a dentist and say, hey, my tooth just started hurting, 2 weeks ago, doesn't mean that the cavity started 2 weeks ago. It has been there for years. Right?
Okay.
So we have to look at the internal structure and the integrity of it, and sometimes it can take quite a fair bit of time to remodel and realign it. Okay, but symptom-wise, the patient will recover very quickly within a week or 2 or 3. The symptoms will be like, wow, they'll feel a lot better. But realigning, okay, so that it never, right, it never get to relapse all the time, right? Yeah, that takes time. So changing posture do take time. Helping with pain management and reversal, strengthening, okay, and manage, right? Usually, within about 1 to 2 weeks, below about 5 to 10 visits, the symptoms of the problem would have gone down by a lot.
Oh, that's great. That's good to know. So you touched on this before, Dr. Khan, about the sort of something to put your laptop on to get up to eye level, and many of us have bought standing desks, ergonomic chairs. Do they also sort of help with correcting posture?
Yes. It's very important because nowadays everybody is walking around with a laptop, right, and looking down at laptop. Laptop is just, they're down.
Yeah.
Right. And you're slouching and both your hands are on a keyboard, right? And literally you can't avoid the head tipping forward and down. So it's like, it's like you holding a glass of water. Is it easier for you to hold a glass of water very close to your chest or away from your body, right? So by the lever system, it becomes very heavy within, if you hold a glass of water away from you, right? And within 15 minutes, it will seem like, it will seem like weigh a ton, right? So it's the same thing with the whole head, right, which is quite heavy. It's like a bowling ball, right, and holding bowling ball away from you. So it's not good to be looking down. So extending it up, and how high, nowadays we actually get the patient to lift it all the way eye level and above.
Gosh.
Right, so that it forces the whole shoulder back, right? So having, a table that can go up and down will be fantastic. And, recently I've been seeing quite a bit of ads that, sell tables quite cheaply that you can actually control up and down, and that helps. Yeah.
Just getting to that right level for whatever height you are.
Right level, and I get them to, get their old books, thick books, and put it as a base for them to put the laptop up. And, for them to extend a keyboard so that the laptop becomes just a screen, right? Or put a screen and laptop become just a keyboard, right? So add additional screen so that it's up high. Yeah. And those little investment, right, will be so good. Your neck will be so grateful if you just invest in some of those extra keyboards or screen and extender and so on.
Exactly. Well, actually, my colleague bought me one, and I use it at home, and it's just fantastic. It's not so much the table, but it's the thing you put your laptop on that you can increase the height, and just so it's at eye level. And I'm sitting very straight when I'm asking you this question, Dr. Khan, because I'm conscious that I'm slouching. Can you give us some tips, perhaps, of what we should take note of, or what stretches we should be doing at home, and how often? All right. Yes.
Despite even when it's up high, our body is not geared towards, sitting in one position for long, right? So it is always advisable to put an alarm clock, right? Every hour and a half, right? Do a stretch. Okay.
Yeah.
Do a general stretch, like stretch your shoulder back, stretch your neck back. Okay. And take a walk, right? So those stretches are very good, and we do give our patient, stretcher sheets, right? A general stretcher sheets where they will stretch their shoulder backwards, neck backwards, right? And the low back backwards, right? And they'll do walk, and they have to, we get them even to stretch their legs because, if your legs are just immobile for longer than a few hours, and that's not good for the circulation.
No, exactly. Well, I appreciate, you speaking to us here on Asia First Weekend Edition this morning, Dr. Khan, and giving those tips. So important. And I know that you have a number of clinics, island-wide, Chiropractic First. I've been speaking with Dr. Matt Khan. He's Senior Consultant and CEO of Chiropractic First.